Cryosurgical ablation is one approach to the treatment of localized prostate cancer. In the past, this procedure has been associated with significant side effects and increased morbidity. Today, with the introduction of third-generation cryotechnology and the use of ultra-thin cryo probes, urethral warming devices, and ultrasound monitoring, cryosurgical ablation can be performed safely with decreased morbidity as an outpatient procedure with minimal side effects and increase in the cure rate of the patient. We will now demonstrate to you a typical case of cryosurgical ablation of the prostate using CDNet technology.
The patient is placed in the lithotomy position and a Foley catheter is inserted in order to facilitate urethral imaging. The ultrasound probe is attached to the brachytherapy template holder. A brachytherapy-like template with 17 gauge holes is attached. The 17 gauge probes are directly inserted all the way to the base of the gland through the aiming template under a constant ultrasound monitoring without the need for an insertion kit or dilation. A total of 12 to 15 probes in 3 to 4 rows are inserted into the gland to assure full coverage of the entire prostate. Each row is controlled as a separate unit by the computerized cryosurgical system. A suprapubic tube is inserted under vision in order to provide temporary urinary diversion. A urethral warmer is inserted over a guide wire. This maneuver can be monitored in the longitudinal view using ultrasonography. The guide wire is removed and the device is secured. Prior to freezing, a final verification of the probe position is performed by sector scanning the prostate gland. The anterior row is activated first. Monitoring in the longitudinal and transverse view is constantly performed. Subsequently, the second row of probes is activated. And finally, the most posterior row is started. In glands that are longer than 27 millimeters, a rim of apical tissue remains unfrozen. Therefore, a pullback maneuver is indicated. The probes are mobilized inside the base ice ball by activating the thaw mode and individually pulling them back 10 to 15 millimeters using the 5 millimeter marks on the probes. A more distal location of the probe tips is verified ultrasonographically. Again, freezing is initiated at the anterior row. The expanding apical ice ball front is headed downwards, whereas the more superior basal ice ball is thawing upwards, forming the double belly sign. The apex is ablated, keeping the sphincter intact. Sector imaging is performed to verify completeness of the apical freeze. After double freezing is completed, probes are thawed and removed. The urethral warmer is left in place 10 minutes before removal. "75 seed-net procedures were performed in the United States using cryosurgical equipment manufactured by Galil Medical Israel. Currently, the procedure takes less than 2 hours to complete. Complications are minimal, and the catheter is removed within 3 to 7 days post-operatively. Currently, an ongoing prospective multi-center study is being conducted for the evaluation of the seed-net approach's efficacy and quality of life advantages.